The commemoration of the day brought to light approaches that communities, advocate groups, and NGOs have adopted to produce accurate statistics in order to effectively treat HIV-infected patients and bring death tolls to zero. According to Dr. Percy Pokea, CDC senior advisor, approximately 34,000 are known to be infected with the virus, 16,000 of which are receiving antiretroviral drugs.
Those are based on the numbers available, based on the reports that people who are actually coming to test. So but we know that there are people out there who don't know that they are positive, but they are still walking around. So the idea is to encourage people to get tested.
One thing that drugs aren't able to cure is the stigma and discrimination that HIV victims deal with every day. Brad Coley, economic officer with the US Embassy, said it was the main reason for the poor state of every country's surveillance systems, and PNG is no exception. On a similar note, US Ambassador Walter North said in his speech the government needed to do a better job of reaching key populations, sex workers and transgender people. He said they are at a higher risk of getting infected with HIV. They face even higher levels of discrimination and stigma, which can scare them away from treatment.
I hope that the department will also redouble its efforts to work with health providers to create health services that are welcoming to people who are different, to people who are like you and I, but who have real needs.
U.S. Embassy Deputy Chief of Mission Joel Maybury challenged Papua New Guineans to continue the fight against HIV and AIDS every day and not just on World AIDS Day. He said HIV advocates could only do as much as speak for the HIV patients forced to live in the shadows. But if many are unable to come out in fear of being ill-treated, how can we stop the spread of HIV? Discriminating them does little to help bring this epidemic under control. Melissa Goviro, National EMTV News.